Hello everyone. Today's case is very important. A young female was presented to us with the history of weight gain, excessive hair growth on the body, irregular cycle, and acne on the face. So we do the ultrasound of the lady, and we found the ovarian size was enlarged, and there were the multiple follicles seen. So this was basically case of polycystic ovaries. Polycystic ovaries, also called as the polycystic ovarian morphology. So on the ultrasound, there is a criteria to the diagnosis of the polycystic ovary. Number one is the follicular numbers per ovary. These must be more than 20 follicles in each ovary. These are also including the dominant follicles. But if we go to the antral follicles, the antral follicles should be more than 10 antral follicles per slice. So the criteria for the antral follicle is that this must be 2 to 9 mm and not more than. The next important thing is the ovarian volume. Ovarian volume must be more than 10 ml, and it should not include the antral follicle. And the antral follicles are usually arranged on the periphery of the ovary, and central stroma is free, and this will give to the string of pearl sign. And the sixth criteria is the central stroma will be more brighter as compared to the periphery. So we can also go for the MRI for the further diagnosis. On the MRI, the ovarian follicle are usually arranged at the periphery, and this will give the low signal on the T1 weighted images and the high signal on the T2 weighted images, and the follicle will be brighter than the stroma on the T2 weighted images. Usually, the imaging is sufficient for the diagnosis, but with the clinical symptoms, we call this condition as polycystic ovarian syndrome. And in this condition, the female have usually multiple symptoms, the like excessive hair growth on the body, which is called hirsutism. The second important symptom is the acne formation, and the third one is the irregular menstrual cycle, and the fourth one is the insulin resistance, which lead to the excessive body weight. So these are the multiple symptoms. So if these are also present, then this condition will be called as polycystic ovarian syndrome. So if the symptoms are not present and the ovaries are enlarged in size, then this will be called as polycystic ovaries or polycystic ovarian morphology. And if the symptoms are present, then this will be called as polycystic ovarian syndrome. Thank you for listening.